And
Recording in
also just turn
progress.
off your cameras before we start. That way, I've got the list of media that we're going to be going through. Everybody who RSVP'd, I've got you on my list to ask a question, but just makes it easier for us to be able to unmute the right person if we've got your name and your news organization listed. And for those of you who are joining us that are guests but not with media, feel free to name and the organization that you're from as well, just so we know who's here. That would be fantastic. And we'll get started in just a couple minutes once everybody is all set. And I believe everybody has the power to record. If you feel that you do not have the power to record, just let us know. We'll make sure that you can. And we are going to be putting out a recording of this after the fact for those of you who want that as well. So, all right, Patty White is saying it says you need permission to record. So could we give Patty and everyone else permission, please? Everybody else okay with recording? Anyone else having challenge with that? Not seeing. Okay, Patty says it works for her.
You're going to have to unmute yourself when you ask the question.
Carolyn, are you there?
Yes.
Hi. Can you send us a clean copy when you're done with this, if you don't mind?
Yep,
Okay.
we'll do that.
We're recording it off of the cell phone, but your version will be cleaner. Thanks.
Yes. Yep, not a problem. We'll do that after. We'll include that link in our press release to
Awesome.
the clean recording.
Great. Wonderful. Thank you. Bye.
Yep. Okay. So everybody good? We ready to start? All right. Thank you so much for being here. This is going to be, we've got 6 panelists up on the screen, and I'm going to introduce everybody to you. First, we're going to have some prepared remarks. And then, as I mentioned, thank you all for sending up your RSVP. All the reporters that RSVP'd and got their link, we'll have a chance for each person to ask a question, and there are quite a few of you. So thank you so much for your interest. On our panel today, you're going to hear from 3 of our panelists right at the top, starting with Andy Muller, who is the CEO of MaineHealth. Next up, you're going to hear from Joel Bottler, who is the Chief Medical Officer of Maine Medical Center. And then we're going to hear from Cindy Wade, who is the President of Lincoln Health. And we know that some of you have additional questions, so we wanted to make sure that we had others on our call who can handle all of those. We've got Joan Boomsma, who's the Chief Medical Officer for the MaineHealth System. Lois Skillings, who is the President of Midcoast Parkview Health. And Mark Foray, who is the President of Waldo and Penn Bay Hospitals, also known as the Coastal Healthcare Alliance. So thank you all for being here. And as I said, when it gets to Q&A, if you have a specific question for any of our panelists, please feel free to direct it at them, or if you want to direct it at the group. And with that, I will hand it over to Andy to start us off.
Thanks, Caroline. I'm Andy, the Chief Executive of MaineHealth, and it's a pleasure to be with all of you this morning. And we wanted to just have an honest conversation with all of you in our communities about some of the very real challenges that we're facing in the moment. And I think that any of you who have visited a retail store lately and have had to wait in line, any of you who've gone to a restaurant and experienced delays, those of you who own businesses and recognize just how difficult it is to hire good help in the current environment, aren't going to be surprised to know that the workforce shortages that are plaguing our country right now have certainly not escaped us. And so we're facing some real workforce challenges. This is not a new phenomenon in healthcare. This is something that has been building for several years, as we have seen declining numbers of enrollees in nursing schools and other healthcare training programs over the last several years across the country. It is built with increasing numbers of baby boomers retiring and leaving the health professions, including nursing, and ultimately has just really accelerated in the midst of the COVID pandemic. And I think much of what our workforce has experienced in the last 2 years as an industry, the anxiety of the unknown, the need to develop a lot of personal courage to risk contracting the disease yourself, the fear of exposing others, and then working in some really difficult conditions, really trying to provide great care to folks in the midst of a pandemic has really taken a toll. And so, not surprisingly, as an industry, we're seeing some significant challenges. Data from the Labor Department in August showed that between February of this year and August of this year, over 500,000 healthcare workers have left the industry, which is just a staggering number. There was a Morning Consult survey that shows that roughly 1 in 5 healthcare workers have left the industry in the past year. Again, just staggering statistics. And you've seen some of the headlines around the country around some of the workforce shortage challenges. So you've seen, for example, in states like California, Indiana, North Dakota, and even discussion in the state of New York, where they have National Guard units that are medically trained, that they are augmenting some of their healthcare workforce because of the shortage that's been created. So when you think about those statistics that I just shared with you, it wouldn't be surprising to think that we're seeing as a healthcare system vacancy rates upwards of 20%. And the good news is we're not. As you look at our vacancy rates, and I think we have a chart that sort of highlights some of this, we're seeing vacancy rates at about 10%. But to be sure, a vacancy rate of about 10% is really, really difficult for us as a healthcare system. So you can see here where we have seen an increase in the number of available positions. A little bit of this represents the growth of the health system, but a lot of it represents the fact that we've just had increasing numbers of our workforce deciding either to leave or to leave the industry altogether. So as bad as it is, we are in many ways better than many other parts of the country. In fact, I had a conversation with a healthcare executive who talked about that when they factor in PTO and other absences, that their functional vacancy rate is approximately 30%. But nonetheless, that 10% rate is high, and it's really putting a strain on our healthcare systems. And it's doing it at a time where we're still battling just a really hot pandemic. We are seeing the largest numbers of hospitalized COVID patients since the pandemic began right now. And so that combined with the workforce shortage is putting a real strain on our healthcare system in general. And then on top of that, we are seeing what is absolutely unprecedented demand for our healthcare services. And that unprecedented demand is being generated from a number of things, including some delayed care that didn't occur last year in the early stages of the pandemic. Some of it is just the continuing aging of our population and increasing in baseline demand. Because the workforce shortage is impacting us all, we've also seen some other healthcare systems in the state recently reduce some of their services, which is putting even more demand on our system, and particularly at Maine Medical Center, where we, in some cases, provide some of the only services in the state for really high acuity care. And so all of that has really made things very difficult for us in the moment. So we're working really hard to make sure that we can continue to provide the right level of care, those necessary services that are required, the really high acuity care that you've come to expect from MaineHealth. But it is a challenge right now. Now, of course, in the middle of all of this too, undoubtedly there are questions about the vaccine mandate. And at MaineHealth, we are really committed to living our vision statement of working together so our communities are the healthiest in America. And so when we look at the data on the vaccine mandate, and I think we've got a slide that highlights some of this, what we have found very clearly is that when we vaccinate our workforce, and we saw that beginning to occur back in December of last year, we saw a significant decline in the numbers of our care team that were out of work for COVID-related causes. And so it's very clear to us that the vaccine mandate really helps protect and preserve our workforce. And while there's a reality that we're going to lose a portion of our workforce, and while the final numbers aren't in yet, it appears that somewhere between 1.5% and 2% of our workforce may leave. And that's difficult in addition to the 10% that we have. We actually think that we're going to have more capability and less shortages in a real way by ensuring that our workforce is vaccinated. And so meaningfully at the end of the day, we don't see the vaccine mandate really being the cause of our shortage. This is a shortage that has been brewing for quite some time. And when we think about doing things that are authentic to our vision and our values, our vision of working together so our communities are the healthiest in America, and our value of patient-centered, having a vaccinated care team seems to align with those pretty clearly, and we're confident in that. So those are some of the challenges that we're facing in the moment. Now, we're doing a lot to respond to those challenges. So we've got a number of work groups that are working diligently to help us think through how we get through the foreseeable future and really what are unprecedented circumstances. So that includes things like really trying to collaborate effectively with other health systems, both in the region and even having conversations with health systems across the country to understand what we can all do together to try to manage through this crisis. It includes our teams working really hard and cooperatively and innovating, living our value of innovation around creating things like a capacity dashboard where we have instantaneous insight into where patients are across our system and where we can see what capabilities and capacities we have to ensure that we're trying to preserve as much as we can for our communities. It means really continuing to invest in our team. And that means not only the $61 million pay increase that we implemented in August, it also means the big pay increase we had back in April. And it also means doing other things to ensure we've got a care team for the future. And that includes things like expanding our wellness benefits for our team with no additional cost passed to our care team members, as well as spending an additional $2 million next year on additional behavioral health services just for our care team to help them through what is a really difficult time. It also means really making big investments in our workforce for the future. And so at MaineHealth, we're committed to spending nearly $5 million next year in partnering with our community colleges and other institutions of higher learning around workforce development efforts that will benefit not just MaineHealth, but all healthcare entities across the state. It means really partnering together with all of our local health systems to ensure that we're moving patients and getting them to the right areas of care. But we're certainly going to need more help than just that. We've got a tremendous demand for services like behavioral health. And then also, we're certainly reeling from the impacts of some of the workforce challenges that our skilled nursing and post-acute facilities are facing in the moment, which means that we've got more patients in our hospitals waiting placement, which is a real challenge for all of us. So to talk more about some of those things, I'm going to turn it over to our Chief Medical Officer from Maine Medical Center, Dr. Joel Butler.
Thanks, Andy. So I thought what I would do today is to start off by talking about where we are today at Maine Medical Center, because unfortunately it gives us an excellent idea of where we are every day. So we get a report every morning at 6:30, and it shows that today we had 643 patients at Maine Medical Center. So pre-pandemic, when we would hit 640 or even less than that, it was when the wheels would start to fall off. Things would get very, very difficult. Today, every day, we average between 600 and 650 patients at Maine Medical Center. And as I looked on the list for today, I see that our emergency department is completely full. 61 patients is what we can handle, and that's completely full. I'll explain in a minute why that is. Our COVID units, we have 32 COVID patients today at Maine Medical Center, and we have another 6 being investigated for COVID. That's about our capacity, and it requires work to get beyond it. Every other area, our critical care units for non-COVID patients, our pediatric ICU patients, our children's hospital, Barbara Bush, labor and delivery, all of them are at capacity today. So you can imagine the stress that occurs. And as Andy alluded to, this is also associated with very significant manpower shortage. And remember, this is not just nurses, it's CNAs, it's respiratory therapists, it's the entire spectrum of who cares for our patients, our techs, technicians, technologists, all of whom that allow us to operate at Maine Medical Center are really stretched thin on the current state. When I think about the volume, there are particular reasons on why our volume is different. Andy's alluded to this a bit, one of which is severity of illness, people who have delayed care during the course of the pandemic. So patients are just sicker. Number 2, of course, is COVID, as I alluded to. The third big category are patients who are ready for discharge from Maine Medical Center, which there are approximately 70 to 100 every day ready for discharge, but we don't have a place for them to go. The skilled nursing facilities, long-term care facilities, all have reduced capacity for the same problem that we have, manpower issues. The issue related to our bed census then impacts the rest of the operations at Maine Medical Center. So our emergency department is a prime example. So today we have 20 patients who are what we call boarders. They're patients who we've decided need a bed at Maine Medical Center, but there are no beds. So they are waiting until those beds become available. In addition, and equally significant, we have 20 patients with behavioral health care needs who need inpatient beds, but don't have a place for it. So an entire wing of our emergency department is for people waiting for behavioral dispositions. So you do some quick math. If we have 40 patients who are waiting for beds, that only gives a capacity for 21 patients who have emergency needs. Unfortunately, this will lead to delays in care when people are coming into our emergency room. In the worst case scenario, which unfortunately happens, the emergency department goes on diversion. And when that happens, we inform the ambulances in the area that we can only take certain conditions emergently. So if someone has a heart attack, of course we'll take them. If someone has a stroke, of course. Trauma, of course. We take care of all obstetrical and pediatric cases. We will take those. But we will ask the ambulances not to bring others. They still will do what's right for the patient. And if they think they need the services of Maine Medical Center, they will still bring them here. And of course, we'll accept them. And any patient walking in the street, off the street, we will take at Maine Medical Center. But you could see the kind of stress that it takes to have diversion. And we have been on diversion more than we have had in the past. The other area which has been greatly impacted is our operating rooms. And there are two things that impact the operating rooms. Number one are the beds. Patient has an operation, they go to our recovery room. If there are no beds, they then wait in our recovery room longer than they typically would, which eventually can back up the operating room. So when we plan every day and every week and every month for our capacity for the operating room, we take that into account. The second factor is the number of people working in the operating room. It's less. We don't have as many nurses. We don't have as many surgical techs as we did previously. And so that limits it. So in reality, we have reduced our operating room capacity at Maine Medical Center by about 30%. So that means there are elective procedures. We'll take hip replacement as an example, which we have had to hold off. We have a backlog of approximately 1,500 surgical cases at Maine Medical Center right now. But on the other hand, any person who comes in with an emergency that requires surgery, 100% of the time we will do that. And in addition, both in the medical and the surgical area, we continue to take care of the sickest patients in the state. That is who we are. That is part of our mission, and that is what we will continue to do. I do want to say that talk about our care team workers. So despite the challenges that I have just described, our care team workers have been exemplary. Two of our values are being patient-centered and excellence. Everything we do is through the lens of our patients and for our patients. And every patient we care for, we meet that value of excellence. And I watch those nurses and CNAs and physicians in all parts of the hospital, the emergency department, on the floors, in the ICU, are not allowing themselves to do anything less than the best for our patients. So that is where we are today at Maine Medical Center. Now I'd like to turn this over to Cindy Wade, President of Lincoln Health in Damaris, Scotland, and Booth Bay Harbor. Cindy?
Thank you, Joel. And I want to thank you for the opportunity to share what's going on in one of our smaller local health system organizations at Lincoln Health. And we are seeing the same real challenges as Maine Medical Center. It's just a little different scale. One of our biggest challenges, and you heard Joel talk about, our swing patients. We have typically around 3 to 5 swing patients in beds at Lincoln Health. And swing patients are patients that are no longer acute level of care, but need some kind of skilled level of care. And typically we would send them to a nursing home to have skilled care there. But unfortunately, the capacity at our nursing homes is quite limited. And so we are keeping them in beds, for instance, at Lincoln Health in that status. Today, we have 14 of our 25 beds with skilled patients in them, swing patients. And we've been as high as 17 out of those 25 beds filled with swing patients, which limits the space for acute care patients. And much like Joel talks about, we try to work with our local skilled and nursing home facilities, and we also try to work with others in our local area and all throughout the state to have these patients move so that we can open up more acute care beds right at Lincoln Health. But we can't find places for them. That's a real challenge for us. And what does that do? Just like at Maine Medical Center, but on a smaller scale, like Joel talked about, our ED becomes extremely busy. I cannot emphasize how busy it has become, and that if you have a condition that could be taken care of in our urgent care in Booth Bay, it's worthwhile to go there. And I'll tell you why. So on any given day, we have 10 beds, and 30% this morning have behavioral health patients waiting for higher level of care for behavioral health currently. We have another 30% of those 10 beds waiting for an acute care bed, either at Lincoln Health or at a higher level of care, like at Midcoast or Penn Bay or Maine Medical Center. So coming to the emergency department, that team is doing an absolutely amazing job. Those are people that are dedicated to their community, dedicated to the patients and the residents of our community. And they are family members of our community. They are taking care of their neighbors. And they're doing a fabulous job, but there's only so much capacity. The recommendation is if you have something minor that can be cared for in the urgent care center in Booth Bay, and you have to drive a little further for that care, you're more than likely going to get that care, that problem taken care of, and be home much quicker than you would if you need to go to the emergency department. And again, it's not for lack of the great teamwork and the great team that's there caring for our community. It's because of just the sheer capacity and the number of people that are in beds awaiting other levels of care and being able to move those people. Again, I can't tell you what a great job the team is doing. It's absolutely impressive to watch. So we're also going week by week, as Joel talked about. We have less numbers, of course, to make decisions on that have non-urgent surgical procedures, but we too are taking a look at that. We're actually looking twice a week, really looking at what's coming for our ORs and what patients need care in our ORs and what can we that's non-urgent put on hold. And we have to ask folks to please be patient and that we are going to get them rescheduled for whatever procedure it is they need as soon as possible. And as Joel spoke to, it's maybe somebody that needs a hip replacement or a knee replacement. But of course, if they have an emergency type surgery or an acute type surgery, we are caring for those patients and bringing them into our ORs. We have been able to expand our critical access beds, which we typically have 25 beds we can use in our critical access hospital. Because of federal waivers, we've been able to expand those beds, but it's very limited. It's maybe 3 more beds at any given time that we're able to utilize. And truly, before a bed even becomes empty, we've already gotten somebody waiting for that bed, whether it's in the emergency department or we're taking a transfer back from Maine Medical Center to help alleviate their capacity, or from Midcoast or some other hospital or organization. And so it's turning over quickly. It's back up in the emergency department. It's back up trying to move people to our long-term care facilities and our skilled facilities. But please be patient. Everybody is there giving a 150% to care for our community and our patients and our residents. And the team is doing the best job possible. And I'm super proud of all that work that's happening.
Yeah, so one of the things I love the most about MaineHealth, as the team knows, is our vision statement of working together so our communities are the healthiest in America. And one of my favorite words in that vision statement is together. Our vision is so aspirational that we can't do it alone. It's going to take all of us partnering together. We want to be inclusive as a healthcare system and helping us achieve that vision. And right now, when we think about what together means, there are a lot of things that as a community, everyone can do to help us in the moment. And the first one is to get immunized, is to get vaccinated against COVID-19. We are clearly seeing that the vast majority of our hospitalized patients are unvaccinated. Those that are vaccinated are rare and typically are extremely elderly and have multiple health conditions. And the reality is that if they were unvaccinated, they would not fare as well as they are faring in this circumstance. And part of the reason that we are seeing proportionally, I think, a worse Delta wave than other parts of the country is because, frankly, we didn't see a big alpha wave. And so we still have a large unvaccinated portion of our state. And the virus is going to continue to burn through the state, finding every single unvaccinated or unexposed individual that it can, and is going to be relentless until it's completed. And so vaccination is the best way to prevent the disease and complications and help us out of this together. In addition to that, as Cindy spoke to, we want you to try to go to the most appropriate place that you can for the care that you need. Our emergency departments are just full right now, and they're full of patients with acute and real emergent needs. They're also full of patients with real significant behavioral health needs, which in many ways has diminished our capacity to care for more. So as a primary care physician, I always believe you should start with your primary care physician if at all possible. If you don't have access to your primary care physician, then an urgent care or walk-in clinic would be a great option unless you have a truly emergent need. So if you can safely avoid coming to our emergency department, we think that's the right thing to do in the moment. One of the other things that we need you to do is just be patient and recognize that we're all working hard to ensure that we can get everyone cared for in a timely manner. I can't say it enough. We have the most amazing care team. I've been in healthcare a long time, and I've been around the block in many places, and I've never seen a team of individuals so deeply committed to the patients, so deeply committed to the concept of excellence, and so deeply passionate about the communities they serve. We have true heroes on our front lines, and I'm in awe and inspired by them every single day, and just humbled to be a part of this team with some incredible people. But recognize they are working hard, and they have been really burning themselves out over the last 2 years, and they are heroes. But right now, when people are having to wait, some of the services that people want in the moment aren't available. A lot of folks aren't being kind right now. Right now, we really need everyone to be kind to our team because they are working really hard. And then we are certainly grateful of Governor Mills' announcement yesterday of enhanced workforce training efforts. We're going to continue to commit financially to our workforce development efforts. But to be clear, we really need a commitment from our state officials and our community college officials that there will be real investment in a sustainable way toward ensuring that we can expand the training programs within the state. And that's critical on so many fronts. So those are some of the things that we sort of ask of our community in the moment as we're trying to manage through what is just a difficult set of circumstances that we're facing. And with that, I think we'll turn it back to Caroline and open it up to questions.
Great. Thank you very much, Andy. So I've got a list of everybody here that said in advance that they were coming, and I'll go through one by one. And again, if you haven't already, please rename yourself first and last name and your news organization. I think most of you have already done that, but a couple of you who haven't added those in, just make sure you have it. It'll be easier for us to call on you. Make sure you're unmuted. First question of the day goes to Brad Rogers from WGME 13.
Okay, thanks so much. Can you hear me okay?
Yes, we can.
Okay. I'm just curious, we've got all these number of COVID patients in there. Can you talk a little bit about, the difficult conversations that you must have with some of these patients? You say the vast majority are unvaccinated. Do many of the patients regret not getting the vaccine that are in there? And I mean, it's got to be just such a difficult situation too for the people caring for the nurses and the doctors caring for those patients as well. Can you just talk a little bit about that?
Yeah, Joel, do you want to take that one?
Joel, just, unmute.
Lois, how about maybe as a nurse and seeing some of those patients in your facility, maybe you could speak to that.
I guess it's me. So what you just described, the question you asked is the amount of moral stress that goes on every day for our care team is really quite significant. So they're caring for patients, particularly in the ICU, who are as sick as any patients we take care of in the ICU. And they're looking at them, they're looking at their families, and they're knowing that had they been vaccinated, this would not be the outcome. Either they would never have been to the hospital, they would never have come to develop COVID. If they did, it may have just been a simple cold-like syndrome. They came to the hospital, be mild, but almost never would it have been so serious that they require the kind of care they required. So for our care team members, it is very, very difficult. And for many of these families, it is also very difficult. Sometimes we see it between where a family member is vaccinated and the patient is not, and they had made attempts to convince them were unsuccessful. As part of this whole pandemic, is this distress that has occurred has been really a key part of it.
And Lois, did you want to follow up on that too?
Yes, I would just add that when we look at the nursing staff, especially in the intensive care unit, the amount of death and disease that they are seeing and the tragedy that they are seeing. I don't know if some of you saw a recent video from Maine Medical Center of the young nurse who said they never imagined in their whole career they would be seeing as many patients go to the morgue. The rate of death and the kind of moral distress that we're seeing by our inpatient staff, they are working so hard, and it's taking its toll on the nurses, on the doctors, and on the nurses' aides, and the rest of the team. But as Andy said, they're still coming here every day, and they're showing up, and they're doing this important work to care for our patients and the community.
And just to add,
Andy, I think you muted. There you go.
there we go. Hey, yeah, just to be clear, if we had no COVID patients, we would still have a workforce shortage crisis. But at the same time, if we had fewer COVID patients, which are extremely resource intensive, and as Lois and Joel alluded to, just really hard for our care team to care for psychologically, it would make things much, much better and easier to manage in the moment.
Okay, we are going to go next up to WERU-FM and Amy Brown.
Thank you, and thank you all for the information so far. I have a couple of questions. One is about the treatment pill, I'm not going to be able to pronounce it, but the new pill that came out that's supposed to prevent hospitalizations and deaths. I'm wondering if you've been using that and what the success level has been with that.
Joan, do you want to take that one?
Yeah, so we're still waiting for final authorization for that, but the data looks very promising. What I can say is that it's in some ways similar to a treatment that we are using extensively, and that is the infusion monoclonal antibodies, which are very effective in preventing hospitalization. And all across our health system, we're able to provide that for symptomatic individuals, particularly those who are unvaccinated, who are likely to get ill. So we're very optimistic that being able to have an oral medication that can also prevent the severe progression of disease will definitely make an impact.
Great, thank you. Excuse me, and if I may ask another quick question, if that's okay?
Sure, go ahead.
Thank you. I know this isn't really within the realm of what healthcare folks ever do, but I'm wondering if the message from the people who survive, who were unvaccinated, ended up in intensive care and survive, if you have access to that unlike anyone else. And it seems to me that people who are not listening to anyone else might listen to those folks. And I'm just wondering if there's any way the hospital could facilitate, or if there's some way that those messages from those folks could be highlighted and got out to the public.
I can grab that one. I think because it sounds like a marketing communications question. I think, we just want to make sure that we're respectful of people's HIPAA rights. So, if we have patients that are willing to speak about it, we certainly would be able to do something. But I think, people often want to we need to respect people's privacy. So, but I don't know if anybody else wanted to jump in there.
And Amy, to be sure, while I recognize that all of the individuals who are speaking are not necessarily from the state of Maine, it's all over the news. There are lots of individuals who survived COVID and had really difficult complications who are speaking out. So I think it's really hopefully encouraging everyone to listen to what they're saying because it's real. It's truthful. This is a horrific disease that you don't want to get, and it's so preventable and avoidable through vaccination and masking and washing your hands and social distancing appropriately and doing all the things we know that can severely reduce the likelihood that you end up in a difficult situation.
Thank you.
Okay, next we're going to go to Stephen Betts from the Courier Gazette and Village Soup.
Hi, thank you. So my focus is on local hospitals. Just wondered, have there been any services curtailed or reduced because of both the workforce shortage and the COVID pandemic?
Yeah, I'm happy to grab that, Steve, since you serve our community so wonderfully. And there have been even local stories of people that have had COVID who offered testimonials. So some of that good work has happened. So Steve, we have had to curtail some services. We do it in a very deliberate, thoughtful way to minimize risk to individual patients and to our communities. So as an example, cardiac rehab, we needed to use those personnel to help staff the medical surgical unit, the ICU, and the emergency department. Likewise, as was described earlier, we've had to cut back on non-emergent and non-urgent procedures. So we recognize that, for instance, if we need to reschedule or delay a total knee replacement, as an example, that is very common in the rest of the world. We haven't been used to doing that here locally, but because of the staffing requirements and the demands created by the COVID pandemic, we've had to delay those procedures that can be safely delayed. And while that's a relatively safe thing to delay, we know that causes hardship for our community members, that they're needing a knee replacement because they're in pain, their mobility is limited. So all of these things we know are difficult for our fellow community members, but those are the decisions that we need to make. And so we, on a weekly basis and even a daily basis, review where can we, as safe as possible, delay some of the care that we know we would like to be able to get to our community. So that's what we've had to do thus far, and we continue to work on this every single day to find out how can we most effectively deploy the resources that we have given the current demands in our community.
Thank you.
All right, our next person up is Dylan Holloway from ABC 7 Fox 23 in Bangor.
It looks like his chat came into the actual chat box.
Oh.
Yes, Dylan, you can ask your question by the chat box.
Yeah, here we go. Okay, yes, go ahead and put your question in the chat. I'll read it out loud for everybody. He has a two-part question. He says, when you say capacity challenges, are you referring to both staffing shortages and a lack of beds and facility space? Is that correct? And then he has a second question, beyond COVID-19, what is the leading illness cause for the high amount of patients in facilities right now? Who would like to take that one?
Joan, do you want to take that? Or Mark, either one.
Yeah,
Sure, I guess I
maybe
can.
go ahead,
Mark.
Joan. So I'll offer a couple of thoughts, and then Joan, you can perhaps offer your concepts. And it's a great question, and I would offer a look at this and think about maybe breaking down some of the origin of the challenges that we have. And as I just briefly list through several challenges, I would keep in mind that any one of these challenges would be incredibly difficult for the healthcare system to respond to. So if you're talking about just caring for patients who actively have COVID, that would be a huge challenge for us moving forward. But on top of that, we have patients who are sick because of delayed care. Managing just that population would be a huge challenge for us, very different than what we normally do moving forward. The behavioral health challenges fallout from the pandemic, people that are out of work and become desperate and unhappy and depressed, managing just that behavioral health component of the pandemic would be incredibly challenging. You move on to the vaccine. We vaccinated our communities. That alone would be a remarkable challenge. Long-term care challenges, EMS being able to transport and move patients effectively throughout the system, and then the labor shortage, particularly with nursing. All of those put together make for a very, very challenging piece. So it's a great question. It's not any one. Any one of those would have been a tremendous challenge for us. You put all of those together at the same time, and you have something that clearly is unprecedented, a term that we use maybe too much, but in this case is very, very apt. Joan?
Yeah, I think you summarized that very well, Mark. It's really a perfect storm of all of those things. Staffing shortages combined with the increased burden of COVID patients, and then a very high demand for other healthcare services has been described. And in addition, the patients that are unable to be discharged to an appropriate site of care, such as skilled or long-term care. So all of those things coming together at once are just creating this incredible demand. I don't believe that we've seen sort of a single additional leading diagnosis. Joel may have some perspective, but it's just a pent-up demand for both medical and surgical care that we've seen. And, this time of year, we start seeing other respiratory illnesses as well. So I don't know, Joel, if there's any predominant illness leading to the high amount of patients, but I think it's.
Yeah, so it really isn't. I think it is the general things, be it cardiovascular, be it surgical, being general medical surgical things that we see. In response to your very first question about the capacity challenges, we have both staffing shortages and facility shortages, but it's not the same every day. So there are days when I told you we had 643 patients at Maine Medical today. There are days when we have 600 patients, but not enough care team members to go beyond that. And so that's a problem. Or there are days, we had a day earlier where we had 698 patients. That was earlier in the pandemic, when we actually had more care team members.
All right, next up, and Dylan, if you, Dylan says thank you. Okay, great. Next up is Patty White from Maine Public Radio.
Thanks very much. So you've talked about, what you are asking the community to do to help you. Can you tell us a little bit more about, if that doesn't happen fast enough, what else needs to happen for you guys? What are you going to do to mitigate what you're facing? I mean, are you looking at reducing services further? Do you need help from the state? Just tell us a little bit more about that.
So I think there are a couple of things. So great question, Patty. We're managing this day to day, every day, trying to come up with the right solutions to ensure that we've got the capacity for some of those really critical services. So some of the things that Joel referenced earlier, trauma, stroke, acute heart attack, all of those things. And so we're going to want to preserve that capacity. We're already, as has been mentioned earlier, reducing some of the elective surgeries that we schedule. And just to be clear, when we talk about elective or non-emergent surgeries, that might include things like knee replacements, but it also includes things like certain cancer surgeries that we think we can safely watch for 2 or 3 months. We don't do any cosmetic procedures in our hospital, so we're not talking about things that are purely elective. These are things that we think can safely wait a period of time, but ultimately they're going to need to be done. So right now we don't have any immediate plans to reduce services, but if things continue, if we were to have a significantly increased surge of COVID patients, we're going to have honest conversations about how we do that and how we manage through the acuity of that type of emergency. And so we don't want to be in that situation, which is why we're asking our community to do those things that we need. We've talked about the workforce development efforts that we're making, that we know the state is making, and the need to really make sure that we're committing to those investments long term. And that we realize that's not going to pay off in February or March. It's going to be a multi-year payoff. But this workforce shortage is not going to resolve in a matter of a year or two. This is going to be a decades-long workforce shortage. So we need to do everything we can within the state of Maine and Carroll County, New Hampshire, to ensure that we are really building the capabilities of the workforce that we're going to need to sustain our efforts well into the future. And then, we need help. Again, going back to our vision statement, working together so our communities are the healthiest in America. And on that together front, we are going to need the help of our state and elected officials. We're going to need the help of our payers. We're going to need the help of our community agencies, all partner together around the behavioral health crisis that we're facing. The pandemic has really placed just an inordinate amount of strain and provoked a tremendous amount of anxiety among all the residents of our states. And so that means that everyone facing increasing challenges with those threats. And so we're seeing unprecedented demand for behavioral health services. A great deal of that is unfunded. A great deal of that, we don't really have the resources to appropriately disposition those patients. And unfortunately, what happens is they collect in our emergency departments. And so on any given day, we may have upwards of 40 to 60 patients in all of our collective emergency departments, simply because that's a place where they can go. But once they get there, we don't have a great place to send them next. We don't have the behavioral health inpatient capacity in our region to meet the demand that we face. And as our community agencies have seen workforce challenges and other challenges in the pandemic, they don't always have the resources to effectively prevent those patients from requiring emergent hospital care. And once a patient ends up in the emergency department with a behavioral health issue, it's not the right place for them. It's a loud, noisy, busy place that is not conducive to them getting better. So it's really not the right place. We've had some of those patients in our hospital emergency departments for weeks and weeks and weeks on end, trying to find a location. So we're going to need help on the behavioral health front if we're going to get through all of this long term.
Thank you.
Next up is Joe Lawler of the Portland Press Herald.
Yes, hello. Thank you for doing this today. I was hoping to ask Dr. Boomsma, it occurred to me this topic of hospital capacity, came up more than a month ago, I believe, and I'm sure you've been dealing with it for much longer, but I mean, just in terms of the news media, like you sounded the alarm back in September, maybe even late August. And so my question is, as this continues, the high numbers of hospitalization continues, it occurred to me that the delaying of surgeries problem may be compounding itself. So now I'm wondering about whether, first of all, are you still having kind of similar amounts where you're delaying at MaineMed, you're delaying about 30% of non-emergency surgeries? And then also, because this has lasted a while, does that mean the delays, the average delay will be longer? I hope that made sense. Thanks.
Sure. Thank you, Joe. Yeah, I think the challenge, as we've talked about, is that we were already catching up from the prior surges. But I do want to stress that, as Joel mentioned, we continue to prioritize care so that the most time-sensitive procedures, the most urgent care is getting done. But that being said, we're not able to provide the level of service that our patients expect and that we'd like to deliver with the delays and the long wait times in the ED. But I do want to echo what has been said about how grateful and proud we are of our care teams, because they continue to deliver the highest quality care under these really challenging circumstances. We also, Joe, are reprioritizing some of the resources we have to address the challenge. For instance, our colleagues and care team members in our home health agency have prioritized their work to make sure that patients who can go home can get enhanced care if needs be in their home because they're not able to get into a skilled facility. So everyone is pitching in, but as Andy said, there's not an easy solution here or an easy end in sight. And so we need to continue to prioritize care as best we can and work on every possible opportunity to solve the problems that we have.
Just very quickly, so are you still delaying about 30% elective surgeries, and is the delay longer, or is it about the same?
So yeah, I think as Joel said, about 30%. Maine Medical Center has reduced their surgeries about 30%. But I should add that each and every one of our local hospitals has been cutting back surgeries. So in that sense, Joe, I think the delays are even increasing beyond just what Maine Med has had to do. So we've had to delay non-urgent surgeries at Southern Maine, at Midcoast, at Lincoln. And on different days, every one of our local health systems has to balance each and every day whether they're able to do surgeries that might take up a hospital bed because those beds are not available. So it will get worse, in terms of some of those delays.
And Joe, that's why our ask of the community to get vaccinated and take precautions necessary to avoid getting COVID are so critical, because that's one lever we can all pull together to ensure we've got the capacity to move through the backlog of surgical cases that are needed.
Okay, next up we have Caitlin Andrews from the Bangor Daily News.
Hey, good morning, everybody. Thank you so much for taking our questions today. So I just want to be clear. I think Andy had said that, this isn't like we're delaying emergency services or we're shuttering emergency services, but we might be approaching that threshold. So I guess, can you talk a little bit more, about what what are we seeing across these hospitals? Are we seeing more consistent diversion? Can we talk a little bit more about the individual places that have had to curtail what services, things like that?
Yeah, so we have not necessarily had to stop providing meaningful services. We've not closed a hospital. We've not done some of those things. As Joel alluded to earlier, at times we've had to go on diversion. And as he spoke to earlier, on a day like today, if we're not careful, we may get down to about 20 or so beds where we can provide those really critical services. And so on a day like today, where that's the case, then we're looking at our other hospitals and looking at low acuity patients and asking the question, could a patient that might otherwise have been admitted to Maine Medical Center be admitted to Cindy's Hospital, for example, or to Mark's Hospital instead? So we can preserve that capacity for trauma patients, heart and vascular patients, advanced stroke patients that really need the care that only Maine Medical Center can provide. And so fortunately, we've not gotten into a point where we've not been able to provide that care safely. And our hope is that we won't. And at the same time, we can't predict the future. And so that's why doing all the things that we know that make an impact in the short term, our ability to manage that capacity, to think carefully and work together as a team, not only within our MaineHealth system, but with other health systems in the state, as well as doing those other things that we all know we need to do: vaccinate, mask, socially distance. All of those things are important to us in the moment. So it really is a day-by-day kind of decision-making process. That's why Joel referenced that call every morning at 6:30 a.m. to make sure that we can preserve the capacity needed for those most critical services that the community needs.
Okay, and so just to be clear, when you say we can't provide that care safely, are you talking across the system or just at Maine Medical?
No, so just to be clear, we have been fortunate that we've been able to provide all of that care, but we want to ensure that we've got the capacity to do that in the future at Maine Med and at all of our facilities across the footprint. And our hope is that if we all do our parts together within the health system, outside of the health system, that we'll be able to preserve that capacity and deliver these services. But that if we get a huge wave of COVID out of the blue, or we see our numbers continue to increase, our numbers have been increasing lately. And that's true in both test positivity, it's true in hospitalizations, it's true in deaths. And so we want to see that trend decline across our state. We need it to decline across our state. Then we may be in a more difficult situation where we do have to say that we can't see anymore in the moment. We've not been there yet. Our hope is we won't get there, but we are taking it day to day.
And maybe I can paint a picture of what it looks like in a day, like what is different today than maybe 2 or 3 years ago before the pandemic. Is that an example is in our small hospital emergency department, we have 22 beds. And on any given day, 10 of those beds may be full of behavioral health patients who are awaiting placement, who need inpatient, but they are boarding in our emergency department, which then brings our emergency department down to 12 beds. And we had a total of 49 patients the week before last one day at one point, which means that people may see care that's delivered differently. We have some stretchers and hallways, for example, where we're delivering care, and the public may not be used to that. They may think, oh, you know, this just doesn't feel like what the care we used to see a few years ago. That's where triaging and prioritizing so that we're sure that we're giving the most critical need care to the patients who need it most in a safe way. But I think letting the public know that the care may look a little differently about where you receive that care, for example, in a hallway in an emergency department sometimes, is still safe, and it's the best we can do given the circumstances that everybody is experiencing right now. But it's still keeping the doors open to meet those critical needs.
Lois, you actually brought up something that was part of my next question, which I'm glad you mentioned it, but also sad that that's happening, which is this question of care in hospital hallways and kind of like trying to like find space for folks. I was wondering if you could talk a little bit more about how widespread that practice might be across MaineHealth and who is kind of receiving that care.
I think it's mostly in the emergency department, speaking for our local health system, but I would say that that's happening across the country and across the state of Maine. It isn't just a MaineHealth or a Maine Medical Center. This is what is happening today because of healthcare systems meeting the needs of COVID patients on top of a staffing shortage, on top of meeting the needs of the day-to-day care that needs to be provided. And so we just wanted to let people know that, as Andy said earlier, that we need people to be patient and to be kind and to recognize that our care team is working so hard to meet those needs in any given moment. And then the next day it can be back to a normal looking. That's why it's taking things day to day and managing it appropriately.
Just to add on to Lois's comments, and it's a really wonderful question. As we look at these interdependent parts of our healthcare delivery system, there are three that have historically been very, very tenuous. And the reason why is reimbursement for their services is very low and has been a very big challenge. And that is behavioral health. The need to, as a society, to be willing to care for the mentally ill, the homeless who have mental illness, and the patients that we're seeing in the emergency department with acute behavioral health issues. That is a long-standing problem made worse today. Transferring our patients or even bringing them in from home if they're sick, as you've read, and I think I would like to thank this group in the press for highlighting these issues. All of these subjects we're talking about have been highlighted at various times. They don't have enough paramedics, they can't hire. And so our ability to transfer a patient that needs tertiary care down in Maine Medical Center with Joel's shop, we're stuck waiting hours, and we're not used to doing that in critically ill patients. Another area that has been historically underfunded, as well as long-term care. In terms of what we can all individually do, I'll just give you a brief example. We're struggling with phlebotomists, the people who draw your blood currently. They've left for various reasons, but one of the reasons is people have been incredibly unkind. So we've talked about people having to wait, and then they finally get into the chair to have their blood drawn and have been quite unkind on a regular basis to the people just trying to draw their blood. And eventually some of them go, I'm not doing that anymore. And so the concept of recognizing the wonderful work being done by people in very, very difficult situations is, I think, a key piece here. And we see that play out across the country in multiple venues. But for healthcare providers who are dealing with angry, disgruntled patients, that makes the challenge even greater.
All right, thank you, Caitlin. I just want to let everyone know we're coming up on 11. I actually still have 6 more reporters with questions. So just so everybody's kind of aware, hopefully everybody's got a little extra time here to get through all these, all this. But next up is Rosalind Flaherty with WCSH 6.
Hi, everyone. I have 2 quick clarifying questions and then 1 regular question. Joel, I think this is for you. I just want to be clear. The emergency department is not on diversion right now, correct?
Correct.
Okay. And then the 32 COVID patients, do we know if they were unvaccinated?
Great. The vast majority were unvaccinated.
Rosalind, we can get out numbers on COVID patients later this afternoon and their vaccination status. We can send that out to everybody.
That would be great.
We get an update later this afternoon across the system.
Okay. And then my last question, I forgot who mentioned this in the beginning, Andy, I think it was you. With CMMC temporarily suspending certain admissions, is that putting a huge strain on MaineHealth? And talk a little bit more about that.
It's putting an additional strain on MaineHealth. And so there's no question that we have seen an increase in patients who've been transferred. And we're certainly empathetic to the challenges that they're facing, because they're facing the same challenges we all are. I think Mark said it really well when he answered the last question. There's no escaping the workforce shortage anywhere. And so that's true at all of our partnered health systems. It's true for our skilled nursing facilities. It's true for our EMS services. It's true for local law enforcement, fire, and police. It's everywhere. And so all of that continues to create a backlog. In many ways, it's analogous to what we're seeing in the supply chain with some of the challenges there. And so if we can't transport patients, it puts more burden on those in a facility like Mark's that are trying to get transferred to Maine Medical Center. And it puts more stress on that staff trying to manage that. And it reduces the capacity in that emergency department. And then ultimately when they get to Maine Medical Center, they may be a little sicker. And so it puts more stress there. And so, yeah, so we've seen that. And it's not just from Central Maine Medical Center, it's from every hospital in the state, because they're all seeing unprecedented demand. And so we're all trying to work carefully together and cooperatively to ensure that we can provide the needed care that our community needs. And I'm really pleased with a high degree of cooperation among the health systems in our region in trying to do the best we can to make sure that we're providing appropriate care in the best location.
Thank you.
Okay, Terry Stackhouse, WMTW News 8.
Hi, good morning, everyone. I just wanted to clarify, in terms of patient communication, in the short term, what is the best case scenario here, if that is a combination of boosting vaccination rates and also understanding when and where to receive the most appropriate care? And I'm also curious, beyond today's press conference, if there's any planned sort of public messaging campaign around informing prospective patients to go into their care with this understanding of the challenges that healthcare providers are facing, and maybe they would want to consider seeing their general physician before going to the ER, or consider going to an urgent care to alleviate some of the pressure that are on the healthcare facilities you mentioned.
Yeah, so Terry, to be sure, that's one of the reasons we're doing this today, is we want to continue to provide those opportunities to educate the community. And I think we are going to be doing some intentional, education, public education, to help individuals understand some of the realities of what we face and sort of where we're at. If we could see this current Delta wave begin to abate and decline, then I think we can start to get back to a little bit more like normal. It won't be completely like normal given the enormity of workforce challenges we face, but it'll feel a little bit more like normal. And I think the biggest thing is if we could just get the COVID to kind of settle down a bit, we could allow some of our care team to catch their breath. I just can't say it enough. We have the best care team and the best caregivers. And these are awesome people, and they are running so hard, and they're doing it because of their own personal commitment to each and every one of you in the community. And so more than anything, I just want them to catch a break and just be able to catch their breath and recharge their batteries a bit, knowing that we've got a long way to go with all of this, for sure.
Okay, Patrick Whittle from the Associated Press.
Hello, thank you very much. Happy Tuesday. Dr. Miller mentioned earlier that the coming mandate, which goes into effect in a couple of days, is not the cause of the shortage, and it sounds like you actually think that it's going to help with staffing, as opposed to causing any kind of additional problems. I believe you said maybe something like 2% staff loss could be attributed to that. Do I have that statistic correctly?
Yeah, we don't know for sure where we're going to end up. We think it's going to be roughly 1.5 to 2%. And again, we believe that the vaccine mandate is aligned with our vision statement of working together so our communities are the healthiest in America. And frankly, that's how we debated it internally. We had our own mandate about a week before the governor announced her mandate. And what ultimately led to us concluding that that was the right thing to do is really applying it through the filter of our vision statement and our values, and thinking about working together so our communities are the healthiest in America, and thinking about our values of patient-centered respect and excellence. We felt that at the end of the day, this was the thing that the action that would be most consistent with those, and that's why we're still a supporter of it. And the data has borne itself out. We've seen that with our own care team, that once we started getting more and more of our care team vaccinated, we saw fewer and fewer of them missing work for COVID-related reasons. And so it gives us great confidence that while we are so sad to see 1.5 of our care team leaving us, these are good people. We care about them tremendously. We're really, really sad to see them go, as are many of our care team that are staying and have been vaccinated. It's hard for them, given the fact that we're shorthanded, watching them leave, and there's real pain there. But at the same time, we think it's necessary for us to protect our workforce, protect each other from each other, and certainly to protect our patients moving forward, that it's the right thing to do.
Can you talk a little bit about what MaineHealth is doing to prepare for the mandate, being that it's essentially expected to go into effect on Friday, and I'm sure you've been preparing this for some time, but are there any sort of late steps that are being taken to get ready for this?
Well, certainly we've been trying to provide education, have conversations, engage in a thoughtful way around those who are considering leaving. And at the same time, we want to honor our value of respect and respect those who've chosen for whatever reason not to get vaccinated. And to be sure, we've also been backfilling roles when we've gotten indications that people aren't going to get vaccinated or intend to leave the organization. We've not been waiting to backfill those roles. So we've been recruiting aggressively. We brought in more recruiters to ensure that we're replacing those positions to minimize the impact to the healthcare system.
Good to know. Thank you so much.
Next up is Brian Sullivan from WABI Channel 5.
Thank you very much. I guess I just ask you to look immediately down the road here into perhaps the next couple of weeks, Thanksgiving, Christmas, indoor gatherings, and you talk about burnout and you talk about the people that are working so hard. Do you feel like this is sustainable, what you're doing right now, and if COVID doesn't abate?
Yeah, we're going to have to do the best we can in the moment, which is why we're really asking on our community to help us out to every degree possible. These are hard times for our care team that really have been heroic. And so they're really counting on all of us to do the right things to try to protect ourselves from getting COVID. As I mentioned before, COVID goes away instantly. It doesn't really solve all of our problems, but boy, it makes a big impact and really gets us farther ahead. And so by working together as a community, we can really make an impact and help our care team out. And they really could use a hand right now.
And just to clarify, if you did have 1% to 2% of your employees, how many not get the vaccine? How many people would that be?
It's probably going to be somewhere, and I'm guessing, honestly, without seeing final numbers, it's probably going to be somewhere between 350 to possibly 399, somewhere in that range.
Thank you.
Sean Murphy from Spectrum News has our next question.
Thanks a lot. Just piggybacking on that, you mentioned 350 to 399 people. Could you speak a little bit more to the potential impact that might have on service? I mean, are you thinking that this is going to be statewide, or do you think that those numbers might be concentrated in a particular facility or in a particular community? And if so, does that concern you?
All of it's concerning. I mean, we would love to have an entirely vaccinated team and wish that no one was leaving us. The numbers that I think we are talking about are fairly consistent with other large healthcare systems across the country who've already gone through their vaccine mandate window. And so I don't think that we're seeing anything that's really aberrant in any way, shape, or form. I think we are seeing what we are seeing really with the public health data is that there's more resistance to vaccination, typically in our more rural communities. And there's a little bit of a reality that we're seeing that in our workforce as well. And we've got higher vaccination rates in our more urban facilities. And so, and that's fairly consistent across what we see in vaccination rates across the population. In our workforce in many ways is a mirror and reflection of the communities we serve.
I guess what I'm getting at is, are you anticipating any kind of potential loss of service? I'm thinking of, you mentioned CMMC, which announced last week they may lose as many as half their ICU beds. Do you see any kind of potential impact like that as a result of these losses?
Not that I'm aware of at this point that we expect to really have to shutter any specific services. I think we'll know more as we get through the final days of the mandate and see where we're at. But I think at this point, that's not anticipated.
Okay, thank you.
Final question goes to Evan Hauk of the Lincoln County News.
Hey everyone, hi Cindy. Yeah, I was just curious, what are some of the strategies that Lincoln Health is using to address the staffing shortages, short term and long term, and kind of what seems to be working and what's not working, I guess?
Hi, Evan. Great question. So as you and I have chatted about before, we have been actively recruiting, and as Andy and others spoke to, the system has been actively recruiting to replace people that we had heads up on that would be leaving due to the vaccine requirement. There are more people recruiting. There are some active different things happening, innovative things. We're going to partner with the Central Lincoln County YMCA, for instance, for a job fair coming right up, where we're going to try to do like a speed dating, but it's hiring, speed hiring to get some folks hired into positions. So we're also actively working with getting more CNAs through our CNA classes that we offer in Lincoln County, and increase some of the numbers with Central Maine Community College, which is the nursing school that we have in Lincoln County as well. So we've been actively looking at this for before, the vaccine mandate. And as we entered into the vaccine mandate, we just ramped that up. And as Andy spoke to before, any position we knew was going to be vacated, whether it was early on in the decision making or the last day of the vaccine implementation for the mandate, we've had those positions hired. We're also looking at how can we creatively utilize staff in some areas to fill in critical needs. And so training and education around that has been happening as well. So there's a multitude of things, Evan, that we've been doing to try to make sure that we're going to have quality and safe care ongoing like we have always had at Lincoln Health. And we want to make sure we're doing that moving forward. And I guess I would say, as Andy talks about working together to be the healthiest communities in America, I can't stress enough how much the support of our local communities, our communities all throughout the state, what the part they play in that. We're all here together, taking care of each other and making sure that our caregivers are taken care of and are treated respectfully, and and just being patient as people come in for care. And I think that we'll get through this.
And before we wrap up, just want to thank all of you. We're grateful for your representation of the community, your messaging to the community, and the jobs that you do. And we want to be a very helpful and transparent organization. So give us the feedback, let us know what you like, and we want to be here to connect and help you as much as we can. Thank you all.
Thank you guys very much. And as Andy said, if anyone is looking for any extra data, we said we could get some of the numbers of those COVID patients out to you. We'll get you a recording of the press conference. And also those two graphs that Andy shared in his opening remarks. We've got those graphs and the data behind them that we'll be able to share with you later on this afternoon. So any additional questions, please feel free to reach out to me, reach out to John Porter, and we will try to get everything that you need this afternoon. And thank you all very much for coming. That concludes the press conference.